Hello, everyone. I'm Lana Zach. Thank you so much for joining me. The U.S. is picking up the pace of coronavirus vaccines as more states start lifting COVID restrictions. As of Friday, more than 55.5 million Americans had received at least one dose of a vaccine. More than 28.7 million are now fully vaccinated. Even with this progress, though, Dr. Anthony Fauci is warning the U.S. could soon face another surge. Total cases in the U.S. are nearing 29 million, and more than 522,000 Americans have died. Despite advice from federal health officials, more cities and states are rolling back restrictions. On Friday, California officials announced some of its outdoor ballparks, stadiums, and theme parks, including Disneyland, will be allowed to open in limited capacities next month. In Oregon, Democratic Governor Kate Brown ordered all public schools to resume in-person learning. Grades K through 5th are set to resume by the end of this month, and older students are set to return by mid-April. And movie theaters and bowling alleys have also opened up again in New York City. Nikki Batiste is there with more.
Across America, glimpses of a post-pandemic life. Tonight, Arizona ending restrictions on bars and restaurants and allowing baseball fans in time for spring training. Connecticut announcing plans to lift capacity limits on most businesses. And Atlanta ready to host the NBA All-Star Game with fans pouring in from out of state.
God bless, I hope so. I would love to see business improve.
But normalcy may be much further off. Tonight, a very different timeline from Dr. Anthony Fauci on Instagram Live.
The logistic constraint of getting the vaccine into people's arms will probably take an additional few months. So we project that anyone who wants to get vaccinated will have gotten vaccinated by the time we get to the end of the summer and the beginning of the fall.
And as states like Texas and Mississippi roll back mask mandates, a sobering new study from the CDC, which looked at counties that allowed indoor dining and those with mask mandates. It found that those with restrictions had far lower rates of illness and death.
It also serves as a warning about prematurely lifting these prevention measures.
As for prevention, there is promising news, as 2 million Americans are now getting a vaccine dose every day on average. That's more than double from Inauguration Day. And in rural Kentucky, an UPS truck dropped off Johnson & Johnson vials to this tiny 25-bed hospital yesterday. The vulnerable include 90-year-old Alberta Thomas.
As soon as I found out about this shot, I said, I will get that one.
Yeah.
I will get that one. It was top priority.
New York state-run mass vaccination sites at Yankee Stadium and the Javits Center got a boost from the addition of the Johnson & Johnson vaccine. Both sites have begun overnight appointments to meet demand. Lana?
Great to see all those vaccines getting into arms. Nikki, thank you. For more, let's bring in physician and immunotherapy scientist, Dr. Leo Nisola. Dr. Nisola, thanks for joining us and for all that you do. So as we just saw, a new CDC study found that infections and death rates have been slowing in countries with mask mandates and limits on indoor dining. It also found the opposite in areas without restrictions. What does this tell us about the pace of reopenings at the moment?
That's right. Well, if the vaccinations continue at the rate that it's going right now, I believe that we can reach at least 70% of the U.S. population to be fully vaccinated by mid-September. So it doesn't make sense to me to loosen the restrictions now. You see, we've learned from this year into this pandemic that flip-flopping on public health guidance has driven public distrust in those agencies. So I believe we should be more cautious about loosening restrictions right now with those life-saving measures.
Well, doses are finally reaching vulnerable rural communities in the United States. How significant will this be in the effort to defeat the virus?
I think if we learned anything from this pandemic, is that it takes a collective effort to tackle a massive health threat like the coronavirus. So tackling it in only one country or only parts of the world will not solve our problem. I think we've seen the WHO's director put an opinion piece today that was very much attuned to this messaging, which I believe is the correct one. I think marshalling a collective response to the coronavirus requires us to think globally and requires a global vaccination scale. And the sooner we get more people vaccinated and immune against this virus, the sooner we're able to tackle those health threats that have been killing millions of people every year, like cancer and ALS. So it is in our interest to make sure that these efforts into tackling this virus is a broad-scale, global-scale effort.
The Director General of the World Health Organization says that the vast majority of vaccines have been administered in, quote, a handful of rich and vaccine-producing countries, while most low and middle-income countries watch and wait. It seems like part of your answer to the last question is getting at this very point about why this is problematic on a global scale.
That's right. At least 10 million people die of diseases like cancer and ALS every year. And right now, all of our research efforts from many of our researchers and scientists have shifted, and drug makers have shifted into creating solutions for the coronavirus. So it is in our interest to solve this problem as soon as we can, so we can get back to solving all of other health threats that are killing many Americans every day. So in that sense, a global scale vaccination effort and campaign that I believe should be spearheaded by the WHO itself should ensure vaccine equity.
Finally, one last question for you, Doctor. The CDC will soon release guidance on safe practices for people who have been vaccinated. Small gatherings are expected to be okay, but it's expected that the CDC will still encourage masks and social distancing in public. Remind us of why it's important to be cautious even after receiving a vaccine.
That's right. Well, it takes some time for the vaccine to kick in and develop those antibodies, so it's not immediate. It's not an immediate effect. But I understand that fully vaccinated individuals are eager to rejoin society and be able to go to their gym, see their family, travel without a safety concern. Now, in order for us to be able to control this, would be very helpful if we had a vaccine passport or a passport that will imply for a vaccine proof or immunity proof. But we still have not gotten to that place yet. So I would love to see the COVID task force under the Biden administration to provide such passports or to allow for them. So we could then be more precise as far as which activities are allowed for those who are fully immunized, and also control who is actually fully immunized and who isn't. And I think a lot of businesses will reopen with those vaccine passports at hand. It will be much easier for them to control their own liability when exposing their employees to in-person transactions.
Very interesting. All right, Dr. Leonasola, thank you.
Thanks for having me.